Part of our mission at this conference here in the Vatican this week is figuring out how to deliver powerful new treatments, sometimes old treatments, to much larger populations, especially underserved populations. Technology has that potential to extend the reach of healthcare providers. Remote Alaska villages are now being treated for mental health conditions through virtual teletherapy sessions. A startup is using drones to deliver life-saving blood supplies to rural areas in Rwanda. Artificial intelligence is being used to mine medical records for treatment insights. But using technology to deliver health care, that's a new challenge. Here to discuss those challenges and how to overcome them, please welcome Donato Tramuto and Dr. Stephen Shaya. So Donato, why don't we begin with you?
It's a pleasure to be here today. Yogi Berra once said, you don't want to make the wrong mistake. So with that philosophical direction, let me just say I am not a physician, though I think I could say I am the doctor of souls. I spent 7 years studying for the Roman Catholic priesthood, a year here in Rome. People often ask me, why did I leave? I left because I didn't want to work on Saturday and Sundays. Now I work every day. But I am the CEO of Tivity Health, which many of you may have heard the program Silver Sneakers. We are providing physical fitness to about 16 million seniors. But I'm also the founder of Health eVillages, which is a mobile technology organization that's providing mobile technology and clinical content to emerging communities. And I will get into that in a moment in terms of what we are doing. Often when I am speaking, I say, nobody really cares what you do until they know why you do it. And I'm reminded by a great quote from Mark Twain, the two most important days in your life is the day you are born and the day you find out why. A little bit of history about myself. At age 8, I lost my hearing to an ear infection. For nearly 10 years, I had very limited hearing. At age 17, I had the benefit of a very supportive family and tremendous amount of advancement in medicine that restored about 60% of my hearing. But through that time, 20 years ago, I had my last surgery, and it was a botched up procedure, and ended up losing the majority of my hearing. Again, I now use technology. During that time, my sister-in-law, who was my speech pathologist, lost her life delivering her second child. And she lost her life because of a medication error, a totally preventable medical error that had the information and the technology been available that evening, my sister-in-law would have lived. And so I found my why through two very significant challenges in my life, what happened to me and what happened to my sister-in-law. But let me say that I also found my why about 10 years ago when I read an article that in our lifetime, 1 billion people will go to their graves prematurely because they never had access to a healthcare worker. 6 million are children who die each year because they have no access to a healthcare worker, to medication, or to clean water. Some people have said to me, Donato, that's not our problem. I totally disagree. Article 25 of the Universal Declaration of Human Rights states that healthcare is a basic right for every single person. And when one person has not had access, we have violated that right. I'm moved by what our Holy Father stated last year. Health is not a consumer good, but a universal right, so access to health services cannot be a privilege. And I think now, if you go back to that 1 billion problem, it haunted me from the perspective, how will we address 1 billion? You can't educate enough doctors and nurses to address that problem. Case in point, in India, a population of 1.2 billion people. Are you aware of how many people have toilets in India? About 45 to 50%. Are you aware of how many have mobile cell phones? It's about 65 to 70. There are more mobile phones than there are toilets in the country. There are 700,000 physicians in India for a country of 1.2 billion. In our country, we have 700,000 physicians for a population of 340 million people. And so the light bulb went off. There's no way we're going to address this problem by educating more doctors and nurses unless you have some factory that can generate one doctor and nurse after another. And so I introduced a new term, and I'm going to introduce it here today. I believe the higher your collaborative IQ, the more we can get done. In fact, I have now used the word collaboration. It's not in the dictionary, trust me. I had introduced it last year at Harvard. It's not in the dictionary. Collaboration. It's no longer about innovation alone. It's about integration and collaboration. And so, in 2011, we introduced an organization by the name of Health E-Villages. It stands for Heal the Villages. And what I thought, could we bring the technology that's out there? I was the founder of a company in 2008 by the name of Physicians Interactive. To kind of give you a 10-second summary, Physicians Interactive became the Facebook of networking physicians. And we brought together 700,000 physicians, and today 3 million physicians are using our medical app. And I thought, what if I could donate that medical platform and medical app to Healthy Villages and go into communities and not necessarily bring physicians into the network, bring the villagers into the network. They are the individuals who know who is expecting a baby, who might need medical care. What I learned is just because you are poor does not mean you don't have an intellect. And let me give you the results. In 2012, we went into a small village in Kenya by the name of Lawala, about 70,000 villagers. 100 babies per 1,000 live births died in 2012. We brought Healthy Villages in there. We educated 85 villagers because we knew that they had an idea of who might be expecting a baby. In 2012, only 24% of the births were happening in a community health center because they were being wheelbarrowed from the village. And when they were being wheelbarrowed, they died on the way because no one had identified them as having a high-risk pregnancy. Fast forward, we put the devices into the community. We trained the villagers of how to turn it on. They then identified that that individual was at high risk. We then communicated. We called Vodafone. We got them to put up a cell tower. We communicated to the community center. We even bought an ambulance. By the way, none of this stuff we invented. So it's not about innovation, it's about integration. Today, infant mortality is down to 20 deaths per 1,000 births. 80, I apologize, I get very passionate in this stuff, 80 more babies per 1,000 live births are alive. The delivery of babies in the community center has gone from 24% to 98%. We also created another problem, unfortunately. Because we are saving so many babies, there were more young children dying from the age of 1 day to 5 years. So we took the same program and we put a pediatric app. And we now have cut the pediatric mortality in half. And those who are dying, it's related to nutrition. And so now we are working with the villagers to help them understand what nutritional value is all about. And my goal over the next 5 years is to cut pediatric mortality out completely. And so we haven't just done this in emerging countries. My new and latest endeavor with Healthy Villages. Ladies and gentlemen, sadly speaking, loneliness is the new chronic disease of the 21st century. And it's not only with our vulnerable population. the veterans or the elderly to whom I spend a lot of time with. It's happening across the world. When the United Kingdom appoints a minister of loneliness, I think that sends a strong signal. 11 million Americans live in rural America, and they are lonely. And the issue there is that in many communities, there's no broadband. And in those communities where there is broadband, they can't afford the technology. So we're bringing healthy villages. We're supporting legislation to get towers. We're helping the seniors who don't and can't afford the broadband to help them and connect them with one another in a virtual way. No one has to spend their last years alone. I will close off. First of all, it's really a pleasure to be here today with Steve, and I think you're going to hear some wonderful things that he'll certainly convey. But let me just close. 2 years before George Bernard Shaw died, he was asked by a reporter to name a famous person whom he missed most, a poet, a philosopher, a doctor. And he sat back for a second and he said, the person who I miss most is the person I could have become. And I leave that with you today because it makes no difference how much we do. It makes no difference how much we give. What makes the difference is that we're doing something, and it doesn't always have to be about innovation. Let's make it about collaboration. Thank you.
Donato, if this Trivity thing doesn't work out, there's a church in Harlem that can that I think could use you, actually. So what you're saying, though, Donato, is that we don't need breakthroughs, new science, new drugs, new technology in this case, to make an immense difference in terms of longevity, infant mortality, and so forth. It's simply applying kind of long-known, old-fashioned medicine and figuring out a way to deliver it to people who haven't been able to get it.
You're absolutely correct. Look what's happened in the concept of kangaroo care, which I believe was identified in Colombia, where now mothers who hold their babies close to their heart and close to their chest can provide as much benefit as if you had that baby in an incubator. And so you're absolutely right. Now, that said, I don't want to, be agnostic and say no innovation.
Of course.
We can't do that. But, when you have 300,000 medical apps out there right now and less than 5% are being used, that tells me that integration probably is not a bad initiative and alternative.
So we need to change the mindset a little bit away from, we can't stop innovation. We don't want to stop innovation, but that's not the answer to everything.
You're correct. I have to tell you a funny story. A few years ago, I was making a presentation at a university in Switzerland, and I had about 500 students there. And I asked, how many in this room want to be known as innovators? They all raised their hands. And then I asked the follow-up question, how many of you want to be known as integrators? 2 people raised their hands. So I think this notion that you're not an accomplished person unless you're an innovator, we have to change that mindset.
We'll get to that. Stephen, tell us a little bit about how you're using technology to deliver healthcare, please.
Thank you, Max, and thank you, Donato. First, very quickly, I wanted to thank the Pontifical Council on Culture, STEM for Life Foundation, the Cura Foundation, Robin Smith, Cardinal Ravasi, Monsignor Trafney for the honor and privilege of being able to participate today. I especially wanted to thank my wife, Samantha, is home with our 3 children. If not for her support, I would not be here, so if you guys get that recorded, I'd be greatly appreciated.
Just bring jewelry home.
And chocolate, I was told. According to the World Health Organization, tens of millions of people are dying every year from non-communicable diseases. A little bit about our company. I'm a family practice physician by trade. We have 16 different companies. We run the gamut from medical distribution to specialty distribution. Most people know us as one of the largest third-party billers of consumable products to the homes in the United States. And we also have a telemedicine, telehealth company, which is what I'm going to be talking about today. We're in 48 states. We're in 28 countries. It's very much a family business. I get fired fairly regularly. Fortunately, I have 3 grandchildren, so it provides a little job security. But I'm here today to talk a little bit about what we're doing on the how we're leveraging technology and innovation. So according to World Health Organization, non-communicable diseases like diabetes, cardiovascular disease, respiratory diseases, cancer are causing tens of millions of deaths annually. And many of these deaths are during the most productive time of life for many of these people. The non-communicable diseases are reducing economic output globally and preventing people, as Dr. Lee said yesterday, from reaching their human potential. The World Health Organization says about 38 million people are dying annually from these non-communicable diseases, and these non-communicable diseases are growing and have been growing in every region in the world since 2000. By 2020, we're going to have 73% of all deaths are from non-communicable diseases, and 73% are global, 79% are low and middle income countries. So there's significant disparities. One statistic I came across, which is pretty staggering, it's the cumulative economic losses due to non-communicable diseases in low and middle income countries between 2011 and 2025 could be as high as $7 trillion. So as we look for ways for sustainable development, we've got to look at different ways. We have to be collaborative for sure, and apply some different thinking. And the obvious challenges you have in a rural area are, of course, lack of healthcare providers, lack of resources, and this is leading and resulting in these tremendous disparities. So we have to take action, and we have to take action now, and we have to collaborate. As Donato said, technology can play a very big role in this, and there's definitely tremendous opportunities to extend reach of care globally. This all started about 8 years ago. I was having breakfast with my father, and we were talking, and he just randomly said, "Son, telemedicine will be big one day." I'm like, "Dad, you're probably right." He's like, "Son, telemedicine, we're gonna be big one day." And I'm like, "Dad, you can't turn your computer on and off." And my dad's like, "Son, faith. And you know, with more will than skill, for sure. We've started various programs around the globe, and these programs are very consistent with the mission and vision of the Pontifical Council for Culture, again, promoting cooperation, collaboration, cultural discovery, and initiatives that spread awareness. I think Pope Francis said it best: to change the world, we must be good to those who cannot repay us. So the crux, the basis of what we're doing really involves a couple different layers. Faith is the core of it, because we really started on faith. We've added and layered in a lot of technology, and we've also tried to build entire communities around these efforts. So we thought that we could make the biggest difference. God's light shines the brightest in the darkest rooms. Areas that don't have electricity, areas that don't have internet. So what we have done is we use solar panels to provide electricity. We use global Wi-Fi. We use satellite to provide connectivity, and we layer that in with several clinical programs. And what we've done is, in several places, be able to build these communities. Now, technology is great, but technology will handle situation now. If you want something sustainable, you've got to build a community around them. That's how you're going to get sustainability. And so that's what we've tried to do. And these efforts all the goal has been to improve health and increase quality of life. St. Francis of Assisi, I think, said it very well. You start with doing what's necessary, then you do what's possible, and suddenly you're doing the impossible. And that's where we feel we're going. So Pietas is what we call a guiding light. It's a movement. It's not a foundation. We're not raising money here today. But the goal is to build these communities around faith, science, technology, medicine, which can unite people and inspire the next generation and bring much needed affordability to delivering care around the globe. Of course, increasing accessibility. Many of the people we're taking care of have no access to care whatsoever. So it's either this or nothing. And of course, improve clinical outcomes, improve quality. So with our technology, and by the way, there's a lot of other comparable technologies out there. But with technology today, you can check someone's eyes, ears, nose, throat. You can listen to their lungs. You can do EKGs. You can do ultrasound on pregnant mothers. The technology's out there. There's a lot of different iterations of it. The technology is out there. And so, whether it's telemedicine, telehealth, video conferencing, mobile apps, sensors, we're all going to be in a connected health environment. Dr. Diomedes talked about yesterday how there's going to be billions of people connected via the internet, and how can we leverage that? One thing that's very near and dear to our hearts, my grandmother used to be a midwife, and she delivered a lot of babies, probably most of the babies in the small Christian village in Iraq. And so we have a big focus in a lot of our programs on mothers and children. I wanted to give you some statistics today on mothers and children. In 2015, the World Health Organization said 16,000 children under 5 die every single day. 45% of the deaths occur in the first 4 weeks, and most of them are preventable. In the same year, 2.6 million children were born stillborn, and those numbers are not really reflected in the numbers that we're talking about. So one of the big challenges is not just providing care, but accumulating all the data and information. So Colonel Ariza, who's set up electronic medical records for the military, who's also here in the audience today, has been an invaluable resource for us to help set up these databases, set up these electronic medical records for these large populations. Many of these people are being seen for the first time. What we're able to do by accumulating all this data and information is you can position resources. So when you're talking about targeting providers, targeting areas, screening, surveillance, having the data and information is invaluable in that. A lot of people think the future of healthcare is technology. The future of healthcare is not the gifted gadgets, it's not the gifted gizmos, it's not the shiny objects, it's the data and information along with the back-end care coordination. Future of healthcare is not tech, T-E-C-H, it's tech, T-E-C-C, technology-enabled care coordination. And that's with Colonel Ariza's help and many others, that's what we've been able to do. So we have this project going on in different places around the world. In Iraq, for example, we're taking care of tens of thousands of refugees that have been displaced, and that program is going. In Ghana, we're providing virtual second opinions for people that have HIV in conjunction with Ascension Health. And in Pakistan, we're taking care of over 1 million mothers and children today that never had access to health care, and that's scaling to 8 million lives. Now, in that particular model, we're in partnership with the Commonwealth Fund. It used to cost them $1,000 per patient per year to take care of these patients. It cost with us $2.50 per patient per year. And we still make 80% margins. It's a for-profit. I'm proud to say it's a social enterprise, but guess what? No margin, no mission. We have to think about these things differently. Those entities that just depend on funding and have no ability for scalability or sustainability, that's not going to get anyone where we need to go. Also here in the U.S., we have a program where we put our technology in churches. We're providing access to it via the community, and 40% of the population does not see a primary care physician in 12 months. 17% of the population in the U.S. doesn't see any healthcare professional, but they go to their church, their synagogue, their mosque. So that's been something that's been very helpful. Donato and I are very aligned on how we believe that we can empower people with their data and information. And so we have apps, for preventative health. You can provide health screening, online coaching, you tie in different wearables. So prevention is a big part of all of this. And as Donato said, we believe passionately that healthcare is a right, it's not a privilege. Everyone matters in this world, everyone matters. And I'll tell you something, just on a personal note, in this very divided world, we were talking at lunch today about all the craziness going on in the world, politically, socioeconomically, culturally, religiously. The world's very divided. The temperature's very high. But just providing access to care, providing dignity, providing hope has done more to build bridges in the places you'd least expect than anything. And one of the things I learned this week, the word pontiff. Pontiff means a person who builds bridges to reach everyone, no matter who they are. And there's actually a book coming out about Pope Francis called The Builder of Bridges. And I thought that was very apropos to what we're trying to do. We're trying to build bridges to people in all parts of the world. And I just wanted to end with a poem. When I was in high school, one of my favorite teachers was my Latin teacher, Brother King, and he shared with me a poem, and I never forgot it, and I wanted to share it with all of you, and it's entitled The Power of Little Things, and it goes, "Great events we often find on little things depend, and very small beginnings have oft a mighty end. A single utterance may good or evil thought inspire. One little spark enkindled may set a town on fire. What volumes may be written with little drops of ink, how small a leak unnoticed, a mighty ship will sink. Our life is made entirely of moments multiplied, as little streamlets joining form the ocean's tide." My friends, in great ways and in small ways, we can make a difference.
I love the passion of both of you guys. However, it's only decaf from now on for both of you guys. So Stephen, tell me though, how do you, first of all, the phrase that came to mind as you were talking there is, it's okay to do well by doing good. So they're not mutually exclusive, right?
Exactly.
You have those margins, otherwise it becomes charity, NGOs, other things that are constantly looking for a way to sustain themselves. How do you go after, though, what's the low-hanging fruit? How do you decide what is going to have the most impact in terms of the sort of telemedicine and making a real impact in these rural areas and underserved areas? Because the need is tremendous, so how do you choose?
So I think a big focus has been around maternal fetal medicine, because obviously it's shown there's a multiplicative effect for taking care of mothers and children globally. Also, the non-communicable diseases, we have certain programs around diabetes, congestive heart failure, respiratory diseases. So just, it's blocking and tackling. You know, it's not sexy. Again, the folks we're taking care of, they literally, it's either what we're offering or nothing. I mean, these people are off the grid. And, you know, the other part of it that's very exciting, you know, when you look at data and information, there's a huge lag time. Go to the World Health Organization. You know, there's usually at least a year or two lag time in a lot of these things. I think the hidden gem here is that when you're providing electronic medical record, there's ways to mine the data that we can make better decisions faster by getting that data and information. A lot of these people are not on the grid because they've never been seen, or even if they're seen, their data is not showing up in these databases.
Wow, unbelievable. We can really make a massive impact here without waiting for genetic revolution or anything else. We can help a lot of people.
Exactly.
Thank you, gentlemen.
Thank you.
And thank you. Your passion, I hope, is contagious here, infectious in a good way to the rest of everyone here.
Thank you.
Thank you. Thank you.